What's going on, guys? It's your boy C Lemons back again with the hacks. Today we are discussing a topic that is becoming a more and more serious issue within the Navy and military in general. We would like to thank Navy Times for making this story public and spreading awareness. For more details and the entirety of this article, please reference the description section. When we think of our military, we imagine courage, strength, and dedication. But did you know that even our brave military members are not immune to the shadowy threats of addiction and overdose? Shockingly, between 2017 and 2021, fentanyl, a lethal drug at the heart of America's opioid crisis, played a role in 52% of overdose cases within the military. The gravity of the situation hit its peak in 2021, when fatal fentanyl overdoses surged to a whopping 88% from previously recorded 36% in 2017.
According to a new report by the Washington Post, and the paper is reporting these numbers, 127 soldiers died from fentanyl between 2015 and 2022.
The impact was felt across all forces. While the Air Force and Army experienced minor increases in overdose fatalities, the numbers for the Marines and sailors shockingly doubled. Before we begin, please like and share this video to spread awareness of this growing crisis. The U.S. Navy is an illustrious institution providing countless opportunities to serve one's nation. But like all organizations, it has its shadows. Today we dive into the growing concern about drug use at Great Lakes Naval Base. As the entire nation combats the fentanyl crisis, so too does the Navy. Multiple junior sailors have tragically lost their lives due to fentanyl on this very base. Investigations into drug smuggling attempts, especially through the U.S. mail systems, have been ongoing since 2020. Records from the Naval Criminal Investigative Service highlight at least 5 investigations into illicit substances mailed to sailors right here at Great Lakes in just 6 months of 2020. These aren't just restricted to fentanyl, but also cocaine, opioids like hydrocodone, oxycodone, and even hallucinogens. A shocking revelation: many of these illicit drugs were sent via the U.S. mail system or camouflaged in repackaged food containers. Now you might ask, why Great Lakes? The base is home to the Navy's basic training and schools for freshly graduated sailors. Those affected weren't just recruits, but also those who had already cleared boot camp. Navy Times, in their pursuit of the truth, face many unanswered questions. The exact number of drug-related deaths, the scope of the crisis, and even mail screening procedures here remain undisclosed. Dive deeper and the stories get grimmer. Seaman Brandon R. Ledesma and Seaman recruit Caleb J. Taper, both awaiting Naval Submarine School orders, are currently facing charges for their alleged involvement in the fentanyl-related death of another sailor late last year. They stand accused not just for their involvement in the tragic death, but also for multiple charges, including drug possession and distribution. Reports suggest they even relocated the sailor's body within a Great Lakes barracks post the tragic incident. Another heart-wrenching story is that of Seaman apprentice Christopher R. Kaser, who lost his life in a fentanyl-related incident in 2020. An enthusiastic individual with dreams of joining the SEALs, his life was cut short by the very crisis we're discussing. Joining the Navy is a noble pursuit, but it's essential to be informed and aware. For all its prestige, challenges persist. As a nation grapples with the drug menace, our sailors shouldn't be left behind. It's a call for action, for better controls, and for safer environments. Combat exposure puts U.S. troops and veterans at substantial risk for abusing prescription opioids and even heroin, more so than the service members who deployed but never saw a firefight, according to a working paper published by the National Bureau of Economic Research. In a study entitled "Did the War on Terror Ignite an Opioid Epidemic?", economists with the Bureau, a nonprofit that conducts economic research and disseminates it to policymakers, corporations, and academia, determined that opioid abuse among combat-exposed veterans was 7 percentage points higher than among those who deployed but didn't see combat. Regarding heroin use, the authors noted that combat exposure also is associated with higher use rates, finding that combat exposed personnel that took heroin more than 1 percentage points higher than the fellow members who never directly engaged with the enemy. The results are first to, and quote, estimate the casual impact of combat deployments in the global war on terrorism on opioid abuse, the authors wrote. Rizal Cesar, associate professor of healthcare economics at the University of Connecticut, said he and his colleagues undertook the study to understand the impact of the United States post-9/11 war footing and its relationship to the veteran opioid epidemic. Our military is not immune to the opioid epidemic. We have lost countless service members to overdose, and if we don't act, we'll lose countless more. Beyond fentanyl, the data reveals an assortment of substances affecting our troops. Non-opioid overdoses represented a quarter of all fatal cases, with alcohol, cocaine, and over-the-counter medications in the mix. Heroin was present in about 14% of incidents. But the numbers give a clear picture. The Army, being the largest service branch, reported the most fatalities. However, breaking it down at annual rates, the Navy and Marines exhibited a worrying upward trend. But who is the most affected? The data is alarming. A significant chunk of those affected by fatal overdoses are young, white enlisted men. The figures are disproportionately high compared to their representation in the military. While steps are being taken to strengthen prevention and treatment programs, a daunting challenge remains: the stigma attached to seeking help for substance abuse. Our military personnel stand at the forefront defending our nation. Let's start with them in the fight against this addiction. If you or someone you know in the military is struggling, reach out. Let's break this stigma and remember, there's strength in seeking help. Hope you found this video informative and it gave you something to think about. Comment on your concerns and questions, like and subscribe, and stay tuned for some more military hacks.